Good evening, Los Angeles. I just got back from the campus of Cal State LA, where I was proud to welcome our new Defense Secretary, who visited that site for his first trip out of Washington, D.C. since assuming the post. Lloyd Austin is a great American, and he came to see other great Americans in action, working across jurisdictions, from City Department of Transportation traffic officers directing cars in to great state and federal employees, including many men and women who wear the uniform, guardsmen and guardswomen, and active service military who have stood up the testing and vaccination site at Cal State LA. Together with other sites across Los Angeles and Los Angeles County, Americans are answering the call of this moment. We've seen a crisis, though, that has reached unimaginable heights. And 500,000 Americans, 500,000 American souls, have now been lost due to COVID-19. 2 days ago, and in coordination with President Biden and Vice President Harris's candlelight ceremony at the White House, I ordered flags at our city buildings to be lowered to half-mast, to mark this moment and to remember those who are not here. This figure, 500,000, is almost too big to wrap our heads around. But we can't forget that behind the number are names. Behind the statistics are stories. Beautiful ones of lives lived and tragic ones of lives cut short. Behind these figures, families are missing a loved one. For Angelenos who have lost someone, we keep seeing them, thinking they just went out for a walk, or they might show up and wake us up from this nightmare. But each day reminds us that they are gone, and that they have left a world behind for us that is now incomplete. The scars across our city are not just the scars of families who have lost loved ones. They're the mental and emotional scars of our health workers who have watched too many lives slip away, of families who are forever altered as long haulers have symptoms that still persist, of business owners who no longer own a business, of workers who are underemployed or unemployed, folks struggling just to get through this horrible moment. They're the open wounds of families still praying for recovery. And while we don't know the full physical and emotional and psychological toll of this tragedy, and we won't for some time, we do know that too many Americans have been left alone with their pain, and so I wanted to mark that today. As I've shared with you so many times here, sharing the stories, your stories, of the people we've lost, make sure that you're looking out for yourself and reaching out to mental health professionals, to your pastors and imams and rabbis, to faith leaders and friends, to family members, and talking about that pain you carry, whether it's somebody lost or just the simple isolation of a year spent alone. Our living rooms and kitchen tables have become cathedrals of grief. And in the months ahead, I promise you, we will mark the loss collectively and as a community. But right now, our mission as a city and as a nation is to do everything possible to keep that number as low as we can, to not let more souls slip away, and for us to be able to be together when we emerge from this once again. The path to recovery is clearer now than it has been at any point in this pandemic. Hope is literally on the horizon. Infections in Los Angeles County continue to drop, and this is welcome news. 19% just since last week. Hospitalizations, 28% since last week. And intensive care units are at their lowest numbers since the beginning of December. All of this is very welcome news. But it doesn't mean the threat of COVID-19 is past. It doesn't mean our vulnerability and the potential loss of our own lives and the lives of loved ones isn't still there. The virus is still spreading each day and is still at dangerous levels. So we need to keep up our precautions and keep up our physical distancing and keep on wearing those masks and keep on washing our hands and keep on staying at home whenever we can, because it's been proven to work. Today, the Secretary of Defense said to a young service member, I want you to know every single time a needle goes into someone's arm, there's a good chance you're saving someone's life. I want you to know that you might not be on the vaccine line, as some of us have been, but every time you put on your mask, it has the same effect. You may be saving someone's life. Each time you keep that distance, you may be saving that person or your own life as well. As you know, last week's storms delayed our vaccine delivery, not just for Los Angeles, but throughout California and across our nation. And it forced us to postpone many vaccination appointments at our large city sites. Those vaccines arrived in Los Angeles County on Monday, and yesterday we administered 17,572 doses, our second busiest day ever. And while we still don't have clarity on the supply chain in the next week or two, simple math indicates we should only see more and more supply in the weeks ahead. So get ready. We certainly are. The city is providing primarily second dose appointments, which we guarantee, and a limited number of first dose appointments throughout the course of this week. And we hope that as early as next week, the beginning of March, we'll be able to accelerate once again first dose appointments for more people. Everyone who had a dose that was scheduled for those dates that were delayed because of those shipments between January 24th and January 30th has had their second dose appointment rescheduled already and received their appointment details by last night. As of yesterday, the City of Los Angeles has now administered 367,206 doses at our vaccination sites, including at our new site in Pierce College in Woodland Hills. As of last week, we've gotten more than 90% of our city's vaccine supply into the arms of Angelenos. We are proud that when vaccines get here, they are distributed and distributed quickly. And we've also ramped up our efforts to make sure that life-saving shots are going to some of our most vulnerable communities as well. At our mobile outreach for vaccine equity, or MOVE teams, we've partnered with trusted community organizations like CORE to administer 5,351 shots in vulnerable neighborhoods in South, Central, and East Los Angeles, as well as in the San Fernando Valley. 96% of the people who have received vaccines at these clinics are people of color, who were grossly underrepresented in the county at large. Though through efforts of the county, the city, we've seen those numbers also dramatically begin to close that gap just in the last week. Today, I visited one of those MOVE clinics in Chinatown, where we saw a need and we filled it. We're in the shadow of Dodger Stadium for too many Chinese-speaking and Vietnamese-speaking seniors who were isolated without a ride or a connection. We weren't getting the vaccines to them that they needed. So we set up shop there in Chinatown at a parking lot. Together with Councilmember Gil Cedillo, we saw that work in action, with organizations from the community and translators bringing vaccine equity to the Chinese and Southeast Asian communities in and around Chinatown. These efforts throughout our city reflect our determination to get this right and to get the right doses to everybody. Whether it was the neighborhood walk I took last week to encourage people to go to the site in Boyle Heights that we had, or whether it was today in Chinatown, we're trying to tear down those structural, economic, cultural, and historic barriers that keep people from getting a vaccine or wanting a vaccine as well. And tonight I can announce another critical step forward in that mission. Beginning next week, our mobile vaccination teams will keep Saturday hours as well. This change will provide additional flexibility to essential workers who work Monday through Friday, who have known there's a vaccine clinic in their community, but simply couldn't get to it because they were at work. There are so many amazing organizations that are supporting this vaccination effort, and I want to thank them. They are the ones who are finding the people who are isolated. But there's also been reports of people impersonating vaccination workers, wearing scrubs, setting up fraudulent sites to try to take people's personal information and money. Don't fall for these tricks, and please report them if they happen to you. No one legitimate will ever ask you to pay money for a COVID vaccine. Nobody. Remember, stick with trusted sources of information when it comes to the vaccine, like our Vax Facts newsletter, which you can sign up for at coronavirus.lacity.org. Today, the County Department of Public Health updated their eligibility guidelines, and exciting news is coming this next week. Starting Monday, March 1st, teachers, other education workers and childcare workers, food and agricultural workers, and emergency services workers and law enforcement workers will be able to get vaccinated at all sites. If you're in one of these groups, you can visit the Department of Public Health's website to learn more about how to book your vaccination appointment at vaccinatelacounty.com. That'll hook you up with our statewide system and all of the now more than 400 places you can get a vaccination in Los Angeles County, which isn't just the highest number in the state, it's the highest per capita number in the state for a big city. This is progress, but we still have a long way to go. When vaccines do get to Los Angeles, we know how to get them into arms without delay. The fact is, we still don't have enough doses. I spoke to the White House today about that, asked for Los Angeles to get even more direct doses as long as it doesn't take any supply away from LA County at large. I talked to them about our ability to double our capacity in our mega sites right away, where we have people who are willing to not only help there, but in our mobile clinics that bring vaccine equity. Fortunately, vaccine production is ramping up significantly. So I said it once, and I'll say it again. Give us the supply, and we will vaccinate everyone by July. At every stage of this crisis, we've maintained our commitment to serving the needs of all Angelenos, including our most vulnerable residents. It's why we led with renter protections, the most aggressive in the country, in place in the first weeks of COVID-19. And those protections are still in place, guaranteeing you can't get kicked out of housing during this pandemic. If you're a tenant facing illegal eviction, you can access legal support at stayhousedla.org. That's stayhousedla.org. And in July, Los Angeles launched the largest renter and landlord assistance program in the country, $103 million of CARES Act money that we put aside to stand up for those who could not pay the rent, to be able to cancel their debts. And this program has been a lifeline to 49,000 low-income households across our city, more households than we've helped in the history of our city with rental assistance. Add to that the utility assistance that we did at $50 million. Now the city is set, thanks to our lobbying and the successful passage in December of one bill, and hopefully soon another one with American Rescue Plan. But just from December alone, we will be receiving $250 million in state and city money that here in Los Angeles will go to LA City residents for emergency rental assistance. This will more than triple the already biggest in country amount to help renters and landlords to cancel their rent debt and to help stabilize our neighborhoods. And if American Rescue Plan passes, we'll go back and do even more. We're working with our state and our city council partners to get this relief out to you as quickly as possible. We are here to help if you're struggling to pay the rent. Even if you've built up months of rent debt, this new program will help you not just pay for 1 month, but look backwards as well. To be notified when this rental assistance application opens, please visit our housing website. It's at HCIDLA. That's HCIDLA.lacity.org. But even as we pave new avenues of relief, we know too many of our neighbors remain unhoused on our streets, in tents, in cars. They still need a place to call home. Since last March, we've brought an unprecedented number of unhoused Angelenos inside. I know driving through the city, walking through the city, it still feels like it's barely a dent, but here are the actual numbers. From the 14 new Bridge Home shelters, to the rec and park shelters that we stood up, Project Room Key sites, and more, together with the county, more than 8,000 new housing outcomes for unhoused Angelenos have been provided in this past year alone. That's on top of the usual more than 10,000 that we provide each year, nearly doubling what we do. In the past 2 weeks, we've housed 200 more people in the expansion of Project Room Key. And as I've said, there's no limit to me. So if you are a hotel or motel owner, or somebody interested in getting more people inside, talk to a motel or hotel owner, and we won't say no. As many people as we can get indoors, we're going to continue to push forward. We opened also this past year 9 homeless housing projects. Those are permanent apartments and 838 beds so that people who get into shelter can move, especially those with the highest acuity who have the deepest needs, whether it's mental health or addiction, other things that they need in services. We now can move nearly 1,000 people into those apartments, but it's simply not enough. We can't put 2,000 or 3,000 people into hotel and motel rooms and shelters and expect that that is their permanent location. We need more apartments, more long-term housing solutions so that people who have gotten off the streets and into shelter can get out of shelter and into more long-term housing. That's why we're working with our county, and I'm proud to share with you tonight, expanding what's called the Lease Up program. If you're interested in helping with homelessness, listen close, especially if you're a landlord. This is an initiative that matches rental property owners, big and small, with tenants who need a home. And it guarantees your rent with government backing. This program works. Since last November, Lease Up has added 1,200 new homes for people and families who just need a little bit of runway and temporary assistance to find a job, get back on their feet, save some money, secure a safe and stable place to live. For property owners, it's a dream come true. That rent is guaranteed to come to you each month without having to hit anybody up for it, without anybody missing a month. That's 1,200 units that are earning market rate rents, receiving 24/7 property owner support, and all connected to dedicated housing specialists and case managers for every tenant enrolled. So if you're a property owner in Los Angeles, we need you. We need your help. And if you want steady rental income, while helping us to end the scourge of homelessness and save lives, sign up by going to leaseupla.org. That's leaseupla.org and click on Get Started. COVID-19 has shined a bright, bright light on inequity at every level, from health to housing to the workplace. And this year, we've witnessed the unique struggles parents face to balance work and childcare, the disproportionate impact on women who've been pushed out of the workforce. All of this has magnified the deep gender inequities that exist within our workforce and economy. No parent should have to rely on his or her sick or vacation days to bond with their child. Not during this pandemic, but not ever. So today, I've signed into law the first ever paid parental leave policy for the City of LA's municipal employees. We're the third largest employer in Los Angeles County. And this pilot program, which we hope will be an example for other employers, especially in the private sector, to provide 6 weeks of fully paid parental time for our city government workforce unable to work due to pregnancy or following the birth, adoption, or long-term foster care placement of a child. It will ensure that thousands of city workers who are our fellow neighbors, who are ineligible for employee parental benefits from the state, can keep their jobs and their paychecks and never have to worry about their economic well-being just for doing right by their families. And I want to thank Council President Nuri Martinez, and I want to thank Councilmember Paul Krikorian for their leadership in getting this done, and for helping bring our city into harmony with our core values of equity, of justice, and equal opportunity for all. Yesterday, we got a critical boost in our COVID-19 relief efforts when Governor Newsom signed a state COVID-19 relief package that includes direct $600 payments to California residents who are in the greatest need, as well as cash bonuses for undocumented Californians who were working hard but cut out of federal relief. The state package also delivers critical resources for childcare, for food and diaper banks, for fee waivers for restaurants and bars to help them get back up, assistance for community college students directly, and relief for cultural institutions and museums who have been shut down. It extends $25,000 emergency grants to hard-hit small businesses. And I'm very grateful to Governor Newsom, to Assembly Speaker Anthony Rendon, and to State Senate President Pro Tem Tony Atkins for their incredible leadership. And LA's delegation in Sacramento did us proud. Your advocacy on behalf of Angelenos and all Californians who are hurting is making a difference. And thanks to the bold leadership of the Biden administration, more help is on the way. Starting today, more businesses are eligible to receive the Paycheck Protection Program, or PPP as it's known, starting with the stores and the enterprises that need it most and didn't qualify before. So here are the changes that you need to know. If you're a business with sole proprietors and fewer than 20 employees, you have a 2-week window right now to apply for PPP funds. That means between now and March 10th, you have priority for these investments. So please take advantage of this window. Take advantage of our opportunity to save LA's small businesses. If you're a business owner who's behind on student loan payments, or who has a prior non-fraud felony arrest or conviction, you're now eligible for PPP. If you got your life together, we shouldn't punish you. We should help you stand up on your feet. And if you're an immigrant small business owner with lawful residential status, you too can now use your ITIN to apply for a PP loan where you couldn't before. You can search for lenders right here in the area at sba.gov/paycheck-protection/find. That's sba.gov/paycheck-protection/find. And as Congress moves, and I hope it will happen swiftly, to pass the American Rescue Plan, the boldest plan to rescue this country in our history at $1.9 trillion. I'm confident this is only the first of a long list of victories I'll be able to share with you. Direct assistance, where the city and the county stepped up when we didn't have those funds coming from the federal government. Finally, help is on the way. In a year when so much has changed, many of us have turned to art, to culture, to music, to make sense of the world around us, to find escape and points of connection with the people we love through books and film and music and poetry. Here in the creative capital of the world, we don't have to go far to celebrate the power and the possibility in the arts. It's part of who we are in Los Angeles, part of what it means to be an Angeleno. And tonight, the city is honoring one of our great minds, someone whose work embodies the spirit of our city, to serve as the 2021 Los Angeles Poet Laureate. We already have a Los Angeles-based national youth poet laureate who made us proud with Amanda Gorman. But today, I'm proud to share with you Lynn Thompson, who many know, an acclaimed writer, an outspoken force, who uses words to tell stories and unite communities and open us up to perspectives. A native of South LA, and in so much of her work, our city, its character, its dynamism, its challenges, and its resilience, they play a leading role. In Hammer and Pick, a poem that she wrote talking about her father and back in another tough time during the Depression, she writes, "Long before I came along, a dream. Daddy told his boys he was glad for any kind of work, and FDR with his New Deal politics was his guy. Always there. If it wasn't for the WPA, my brothers say, they would have had nothing to eat, peace and glory." And it comes down at the end to say, he didn't think of history. Hoped his kids would survive another potatoes and water supper. Don't you remember? The brothers say they were better off than many. They were the ones with a drum. We must find our drum at this moment, and to see the power of all of us coming together, and government rising to this challenge, of private people finding their neighbors, picking up a hammer or a pick or a syringe or a grocery bag, to bring the aid that will accelerate that hope that sits there on the horizon and bring it to us even sooner. As we march forward towards recovery, I know that her poetry will help us set our sights on a brighter and better future. And Los Angeles, that future is within our reach. And I know we will get there together. So stay safe and stay healthy. And whenever you can, stay at home. Thank you, and sending you strength and love this evening, as always. With that, I'm happy to answer questions.
Thank you. And our first question comes from Ron Lynn from the LA Times. Please go ahead.
Hey, Ron, how you doing?
Hey, good. Thanks, Mr. Mayor. Really appreciate you talking with us today.
Always.
So our question today is about looking back at whether California and LA's tough COVID stay-at-home restrictions were worth it. As you might have seen, there's this argument on social media that points favorably to Florida's actions during the pandemic, in which Florida kept many businesses open, and its cumulative COVID death rate is only 15% worse than California's. To be sure, California might have been dealing with some worse things, such as the California variant that scientists now believe spreads more readily and is associated with more severe illness and death. Can you respond to this argument that California's and LA's tough measures weren't worth it? Thanks so much.
I don't know, Ron. I would say, what's the cost of a life? How do you measure that? When you say 15%, that's a statistic, but as I said, that's a story. That's 15% more families that do have their loved one alive here. And I think that's probably, as you pointed out, doesn't tell the whole story because we're a much denser state in our metro areas. In many places, we have much greater vulnerability than Florida. So comparing apples and oranges, but also seeing these numbers. Not only are more Californians alive because of what we did, I know how painful that economic decision was. I had to make it. It was the heaviest decision of my life, but as I said, in some ways it was one of the easiest ones. Because you can't count the lives saved, you can only count the ones lost. And we did everything we could. We are still doing everything we can, whether it's assistance for restaurant workers, direct grants for businesses. And I would hate to get in this business of comparison of, well, it's worth to have a little bit more economic prosperity for 12% or 20% more deaths. More death is more death. And to me, I decided at the beginning of this I would do everything I could to follow public health directives, to, yes, keep as much open as we could in good conscience while still protecting people, whether that was the construction trades, whether that was with protocols like we've seen in other industries. But to me, a life is a life is a life, and everyone is sacred and worth protecting. Any follow-on?
No, thank you very much. Really appreciate it.
Thank you, Ron. Appreciate it. Next question.
Thank you, and that comes from Albert Cerna from the Boyle Heights Beat.
Hey, Albert, how you doing?
Hi, Mr. Mayor. Thank you for taking the question.
You bet.
I wanted to ask, on Sunday, a mobile testing site opened in Ramona Gardens, which was meant for folks 65 and older and the at-risk communities. However, as the LA Times reported, people from out of the area managed to jump the line. In some cases, these people were not eligible for the vaccine. This has spoken to an issue of equity and accessibility. Has the mayor's office worked with Governor Gavin Newsom, the Department of Health, and other officials to prevent this going forward? And are there consequences for line jumping, especially for those who come from areas like Beverly Hills and lower risk areas and who are not eligible?
Yep. So this was one of the things that we just briefed Secretary Austin about, and I think the federal/state site at Cal State LA that we provide some assistance with traffic and things like that they're running, which by the way is a really well-run site. We're walking through both the walk-up and the drive-through center. I'm very proud of what they've done in our small role in helping them work there. The intention was good, which is set aside 1,000 or 2,000 doses for community groups. They gave it to the community groups, but they gave it with an electronic code. And one of the things I just shared is we all learned those lessons early on too. It wasn't codes, but you read the articles, the 50 people who weren't supposed to be there, who weren't public health workers, got into the Crenshaw site, et cetera. On balance, I think, no question, this has been highly successful at targeting vaccines to the people who qualify. But you raised an excellent point, and one that I'm very passionate about, which is that the most connected communities will always find a way more quickly to get to vaccinations. And I do hope that my advice was the way we do our mobile clinics, we work with those community groups. We work with our family source centers and other programs where we already serve seniors, we already serve low-income folks, we already serve people of color. And then we work through a ticket system where we give a physical ticket to folks, or we walk that neighborhood just before so that those folks know, and we can really encourage them to come to that place in the neighborhood. So our statistics kind of bear that out. All our mobile teams are serving people in those neighborhoods. There might be a couple people who come in from outside the neighborhood, but more than 90% come from the neighborhood. And we're happy to share those lessons, whether it's with the feds, whether it's with medical providers and others. And I think they're going to make those tweaks, already are, to make sure that doesn't repeat itself. In terms of consequences, there aren't any specific consequences, but it isn't the right thing to do. We should make sure that folks not only qualify for where they come from, but also the age and profession that is allowed. I look forward to the day, and I think it's coming sooner than we can imagine, that in a month, month and a half, maybe 2 months max, where I think all of these tiers basically go away because we're going to have so much vaccine supply in this country. I'd much rather, as a vaccine provider, vaccination center administrator, be told, hey, you can just go into this zip code. Like when Boyle Heights, when I was walking door to door there last week for our mobile clinic, which is a different one than the one you mentioned, I ran into a young man who'd lost his mother February 3rd. The week before, as I talked to people door to door, 16 people in Boyle Heights died. Even as we welcome the numbers coming down, these are brutal, brutal numbers. So we're happy to share those. I think we're not going to not have to worry about there being enough vaccine soon, which is why I'm focused on making sure when we do have that vaccine, these mobile teams are going to double for the city of Los Angeles. Thanks. Any follow-up?
Yes, sir. You said that there are currently no consequences, but without those consequences, how will you prevent people from continuing to skip the line? I mean, if people know that, hey, they can jump in even though it's unethical, how do you prevent that? It's going to happen. You know, what is to deter people from continuing to do so?
Well, I don't have any jurisdiction in a federal or a state site, so I think that's a question probably better directed towards them. The way we fixed it is just to erase that ability by setting up a system that serves folks in the community. To me, it's not so much finding one or two people and punishing, because oftentimes people who got these emails, it didn't say, hey, this is a secret thing and it's only supposed to go for local folks. Somebody actually wrote an email that took the code, changed it, and had a very plausible story that said that the National Guard was soft opening and testing it, it needed volunteers. So I wouldn't punish somebody who simply is trying to do what everybody is doing, wait for something that seems credible and wants to get a vaccine. I would just tweak it, close it up, change the system if necessary, and that's what we've done with the city sites. Thanks. Next question. You bet.
Thank you. And now to the line of Dakota Smith. Please go ahead.
Hi, Dakota.
From the LA Times.
Good evening, Mayor. Just wanted to get your reaction today to something that Council President Nuri Martinez and Councilmember Paul Krikorian did, which was to introduce a motion to request through the California Office of Emergency Services an advance of $150 million from FEMA to provide 10,000 hotel rooms for the next 6 months. What's your reaction to that? And you've said that you've asked the feds for help on this in the past. What specifically have you asked for?
So there's a few questions, and then let me try to tackle them backwards. I've had so many conversations with so many federal leaders, both during the Trump administration, Secretary Carson, and now with the Biden administration. It's tough for me to remember them all. But what I've said in simple terms, and good to see both, we had some breakthrough with then Secretary Carson and now with the Biden-Harris administration as well, is you need to do three things. One is give us reimbursement for housing. If we want a FEMA-like response, you can't wait, and this was long before the pandemic. I argued, for instance, when we thought El Nino was going to flood our streets, give us money now to house people before they drown. And they say, sorry, the way FEMA works at that point was only after a fire, after a flood, then they house people who have lost their homes. For the first time, that changed. It changed last year under the previous administration. It's being continued and ramped up under this administration. But it's the first time in American history where assistance is given to people before the disaster hits them, that we can not only house folks that are COVID positive on the street, but COVID negative on the street. So that's one. Second is I've called for full reimbursement, and that's finally come through. That's something I've said throughout and had conversations with both the previous administration and the current one. Three, I asked for direct assistance. That resulted in the CARES Act dollars that went to big cities. Cities weren't written into that. And a conversation I had with the White House just the night of it was being written and always going to be delivered to states resulted in that hundreds of millions of dollars that we got, which a big part of that we put into homelessness. For instance, when Project Home Key, which is to buy buildings to move people into for more long-term housing, ran out and we got as many buildings as we could with the state money, we were able to take some of the ones the state couldn't fund and fund them directly from that CARES Act money. Four, I've told the state that we need to continue this program. Five, I'm working with the White House to make that as an example, Project Home Key, as something that we can get at the national level, hopefully some funding for. And there's $5 billion in the December bill, and in the American Rescue Plan, I think also another $5 billion that would go towards homelessness, and hopefully it can be implemented to serve towards this. And then lastly, I love the motion. I've always said there should be no upper limit. LASA and others and providers can tell us when they don't have enough people to staff those rooms, but that's a good problem to have. Let's keep going. There's kind of three problems. We need more rooms, so we need, as I will reiterate every time I can, hotels and motels, whether you're an owner-operator or whether you're somebody who knows of one, get those in the pipeline so we can continue to have those conversations. They're more difficult than you'd think. Second is we need to make sure there's money. I love getting that up front. If we get it up front, though, it can only, of course, go towards the rooms we successfully get. And then third, we need faster turnover, which is why I made the appeal here tonight for more landlords to help us get permanent, or long-term, I should say, housing solutions. Guaranteed rent, a good tenant who has services behind them to get those beds rotated out. We can brag about the number of beds, but I'd rather be talking about the number of people Give me 2,000 beds, and if it turns over 2 times, I'd rather have those 4,000 solutions than 3,000 beds that never turn over. So those are the things that I've lobbied for, will continue to lobby for, and I think it's a real sea change moment. And I hope that the state, and I'll be amplifying more and more with my fellow mayors and city officials throughout the state, with the state between the surplus that they enjoyed because of high-income folks making more money in this pandemic and paying their income taxes, and the state assistance, there's going to be tens of billions of dollars of surplus. I know it needs to stabilize the state's finances, put back into a rainy day fund, but this is a moment to think big, both for the short-term solutions of things like Room Key, and that money I would welcome, and I will certainly support the motion when it comes to my desk, but also the long-term ones. Give us more money. Give us, I would say, if I were the governor or the state legislature, they should be thinking with numbers with a B in terms of $1 billion or more dollars for us to be able to purchase more apartments, purchase more hotels and motels. This is a moment to strike when both the resources are there, the problem, the will, and the logistics. Thanks. Next question, please. Thanks.
And our final question for the evening comes from Victor Cordera from Estrella TV. Please go ahead.
Hey, Victor. Hola. ¿Cómo estás?
Alcalde, ¿cómo estamos? Buenas tardes. Le voy a hacer
Buenas
mi
tardes.
pregunta en español. De hecho, tengo 3, voy a tratar de ser rápido y después las hago. Voy a empezar en inglés y luego si me las puede contestar en los 2 idiomas. Primero, some of our fruit and vegetable field workers live in rural communities that hardly have access to internet. What are the plans to vaccinate these fundamental workers, men and women who in some cases do not know how to make an appointment online, and some of them hesitate to share their personal info because they are afraid it is going to be shared with ICE? Number 1. Number 2, this increment of $5 to grocery and drugstore employees, and believe me, I do believe they deserve every penny of it, but how can we reassure our low-income communities that it's not going to increase the cost of basic food, milk, eggs, etc.?
Yep.
And last but not least, if you can just be a little more specific about the help that you are providing to some of the small business owners, including those that, if I'm not mistaken, is going to be valid to those of us that are not legal in the country.
Perfect.
Thank you.
Thank you. Muchísimas gracias. So I'll answer 2 of them in English and Spanish, and then the third one I've talked about in English, so I'll just talk about it in Spanish in my address. First, rural communities. Obviously, I'm not the mayor of any of rural communities, but I have watched very intensely what the state is starting to do, especially for those agricultural workers. They are now taking the model of mobile clinics, similar to what I was describing the city is doing, and taking them into rural and farm areas in the Central Valley and other agricultural areas, Imperial Valley, San Diego County, and other places, to be able to vaccinate workers who are in those rural areas, face language barriers, technology barriers, and they don't have to make appointments. The mobile clinics will come to them, and they'll sign them up as they're there. That's the model that we've used quite often. In Chinatown, for instance, nobody that I was logging some people in today, since I've been trained to do that by CORE over at Dodger Stadium, and none of them had appointments. They were brought by community groups. They were brought by neighbors, and it's a similar model I believe the state is doing. Por los trabajadores en el Valle Central, trabajadores, agriculturas, el Estado tiene un plan por estos sitios móviles, porque estos trabajadores desafortunadamente no tienen acceso por la tecnología, acceso en la geografía, acceso a una clínica. Por eso es necesario atraer las dosis de la vacuna a ellos en sus lugares de trabajo. Y yo no tengo la responsabilidad porque yo no soy el alcalde de estas áreas, pero el Estado y el gobernador Newsom está trayendo estas dosis en este programa, trabajando con los sindicatos de agriculturas, con los dueños también de la tierra en esta serie también. So, esta es la solución para proveer más protección para nuestra comunidad. Secondly, I absolutely 100% support the hero pay for our grocery workers. And with any good conscience, it shouldn't raise food prices, because you see grocery stores are one area that have record profits, more money than they've had before. And many of them had been paying this hero pay because they've seen, for instance, double the profits that they've ever seen. Share that with some of the workers, and these were keeping prices where they were. So I hope that they will see this, maybe be inspired by it instead of being threatened by it, and make this a policy across chains across America, as well as for, these are for the large supermarkets. So this isn't hitting right now the mom and pop store, the small tienda or something at the end of the block. Yo apoyo la legislación para proveer más dinero a los trabajadores en los supermercados. Y los supermercados tienen más dinero, un récord de dinero durante la pandemia. Es mi opinión que ellos deben dar una porción de a sus trabajadores. Este fue el modelo por muchos de las compañías, pero ahora desafortunadamente estos programas han desaparecido. Pero no deben resultar en precios más altos por la gente, porque más dinero en profit por los supermercados es el derecho de los trabajadores que están trabajando en estos tiempos en un momento muy peligroso a su salud, la salud de sus familias. Ellos merecen una beca, una recompensa por esto, una recompensa. And with small business owners, I'll say something briefly here too. I think I shared it already in English, the programs that folks are now eligible for. Hay asistencia en estas próximas 2 semanas por los negociantes en los negocios en Los Ángeles, especialmente en negocios pequeños. En el pasado, inmigrantes, por ejemplo, dueños inmigrantes no pueden aplicar por este dinero. Las regulaciones están cambiando para proveer estos fondos y en mis palabras yo tengo la información donde usted pueden aplicar por este dinero en estas próximas 2 semanas. So with that, I'll detail that, and thank you again for everybody tuning in English who stuck around for my Spanglish section, and now I will go into Spanish. Muy buenas tardes, Los Ángeles. Acabo de regresar del sitio de vacunación en Cal State LA, donde estuve con el secretario de Defensa Nacional, Lloyd Austin. Hablamos de cómo colaborar para acabar con esta pandemia. Desafortunadamente y trágicamente, hasta ahora hemos tenido 500,000 víctimas en nuestro país de COVID-19. Hace 2 días, en coordinación con el presidente Biden y la vicepresidenta Harris, ordené que las banderas se bajen a media hasta para marcar esta trágica pérdida. Seguimos nuestra misión para hacer todo lo posible para salvar vidas y acabar con esta pandemia. Esto solo lo podemos lograr juntos y estamos progresando. Las infecciones y las hospitalizaciones siguen bajando aquí en Los Ángeles. Y aunque estas son muy buenas noticias, necesitamos continuar nuestros esfuerzos para protegernos porque el riesgo de infección sigue presente. Siga usando su mascarilla, mantenga el distanciamiento social y eviten reuniones. Seguimos nuestro trabajo para vacunar también a angelinos. Aunque las tormentas de la semana pasada causaron retrasos por todo el país, el martes logramos abrir nuestros sitios de vacunación de nuevo. Y ayer administramos 17,572 vacunas en nuestros sitios de la ciudad. Ahora estamos ofreciendo más que todas citas para la segunda dosis y algunas pocas citas de primera dosis. Todas las citas de segunda dosis para personas que recibieron su primera dosis entre el 24 y 30 de enero se programaron automáticamente y recibieron sus detalles anoche. Desde ayer, nuestra ciudad ha administrado 367,206 dosis de vacunas en nuestros sitios de vacunación y hemos utilizado el 90% de nuestras dosis. Además, ampliamos nuestros esfuerzos para vacunar a las comunidades más vulnerables, especialmente las comunidades de color, de inmigrantes y de latinos. En nuestros sitios de vacunación móviles, colaboramos con organizaciones de la comunidad para administrar 5.351 vacunas en el sur, el centro y el este de Los Ángeles. Y más de 96% de las personas vacunadas en estos sitios han sido personas de color. Y hoy puedo anunciar que empezando la semana entrante, estaremos operando estos sitios móviles los sábados también. Este es nuestro compromiso para acabar con la desigualdad y asegurar el acceso a vacunas para todos los angelinos. Usted puede apoyar este esfuerzo con donar al Mayor's Fund de Los Ángeles en la página mayorsfundla.org. Aunque hay tantas organizaciones preparadas para ayudar, nos enteramos de que hay personas haciéndose pasar por trabajadores de vacunación, llevando uniformes médicos, instalando sitios de vacunación falsos para obtener detalles personales de la gente o su dinero. Es importante que dependan solamente de fuentes de información legítimas para saber más sobre la vacunación. No se deje engañar. Nadie legítimo jamás le va a pedir dinero o su número de seguro social para recibir una vacuna. Nadie. Hoy el Departamento de Salud Pública del Condado actualizó sus pautas de elegibilidad para la siguiente fase de vacunación. Empezando este lunes, 1 de marzo, trabajadores en educación y cuidado infantil, tanto como en alimentación y agricultura en servicios de emergencia y aplicación de la ley, podrán recibir la vacuna. Si usted está en alguno de estos grupos esenciales, puede visitar la página web del Departamento de Salud Pública para programar su cita. Visite vaccinatelacounty.com. Sin embargo, todavía nos falta demasiado. Aún no tenemos suficientes dosis, pero tenemos la capacidad de administrar muchas más. Afortunadamente, vemos esperando que pronto la producción de vacunas se va a ampliar. Pfizer va a triplicar su producción. Moderna estima que va a doblar su producción en abril. Y si se aprueba la vacuna de Johnson & Johnson, pueden entregar 20 millones en el próximo mes. Como lo he dicho antes, en Los Ángeles estamos listos para administrar más vacunas. Si nos dan la provisión, acabaremos para julio de este año. Durante toda esta crisis, siempre nos hemos comprometido a servir a todos los angelinos. Implementamos protecciones para inquilinos al principio de la pandemia y siguen en vigor. Si usted es inquilino con el riesgo de desalojo, pueden obtener apoyo legal en stayhousedla.org. Y ahora estamos colaborando con líderes del Estado y el Consejo Municipal para distribuir más de $250 millones más, dólares federales, que recibimos para ayudar a inquilinos con la renta. Para recibir avisos cuando se abran las solicitudes para el programa de alivio de alquiler, visite hcidla.lacity.org. Desde marzo del año pasado, hemos brindado un hogar a angelinos sin vivienda. Agregamos más de 8,000 nuevas soluciones de vivienda para personas sin hogar. A la vez, hemos trabajado con el condado para expandir el programa de Lease Up, una iniciativa que une a propietarios con inquilinos que necesitan un hogar y garantiza su alquiler con apoyo del gobierno. Desde noviembre, Lease Up ha agregado 1,200 hogares nuevos para personas que necesitan asistencia para encontrar trabajo, ahorrar dinero y una vivienda estable y segura. Si usted es un propietario en Los Ángeles y quiere inquilinos confiables y quiere ayudar a acabar con la falta de vivienda, visite leaseup.org. Este año hemos visto la lucha que enfrentan los padres de familia con su trabajo y el cuidar de sus niños. Ningún padre debe tener que usar sus días de enfermedad o vacaciones para estar con sus hijos, ni durante la pandemia, ni nunca. Así que hoy he firmado la ley de permiso familiar pagado para empleados municipales. Este programa piloto da 6 semanas de permiso familiar pagado para empleados de la ciudad que no pueden trabajar debido al embarazo o después del nacimiento, adopción o colonización de un niño en un hogar de crianza a largo plazo. Perdóname, otra vez. Este programa piloto da 6 semanas de permiso familiar pagado para empleados de la ciudad que no pueden trabajar debido al embarazo o después del nacimiento, adopción o colocación de un niño en un hogar de crianza o largo plazo. Logrará de miles de empleados de la ciudad que no califican para el programa de permiso familiar pagado en el Estado pueden mantener su trabajo y sus ingresos, sin tener que preocuparse por su seguridad económica solo por estar con sus familias. Quiero agradecer a la presidenta del Consejo, Nuri Martínez, y al Consejo, Paul Krikorian, por su gran liderazgo en esta iniciativa. Ayer el gobernador Newsom firmó un paquete de presupuesto estatal histórico de COVID-19 que incluye pagos directos de $600 a los residentes de California más vulnerables, así como subsidios en efecto para residentes indocumentados que quedaron fuera de la ayuda federal. Y gracias al gran liderazgo de la administración de Biden, más ayuda está en camino. Empezando hoy, más pequeñas empresas pueden recibir préstamos del programa Paycheck Protection o PPP. Si es una empresa con menos de 20 empleados, tiene un plazo de 2 semanas para solicitar estos fondos. Si usted es un empresario que está atrasado en los pagos de un préstamo estudiantil o que tiene un arresto o condena por un delito no grave, ahora usted es elegible para el PPP. Si usted es un empresario inmigrante con estatus de residencia legal, ahora puede utilizar su número ITIN para solicitar un préstamo de PPP. Puede buscar prestadores en sba.gov/Paycheck Protection/Find. sba.gov/Paycheck Protection/Find. En el último año tan difícil, muchos hemos usado el arte para reflexionar sobre nuestro mundo. Celebrar artistas es parte de quién somos en Los Ángeles. Y esta noche nuestra ciudad está honrando a alguien que representa el espíritu de nuestra ciudad, para ser el poeta laureado de Los Ángeles en el 2021. Lynn Thompson es una gran escritora que utiliza las palabras para contar historias y unir comunidades. Sé que su trabajo nos ayudará a visualizar un futuro mejor y más brillante. Los Ángeles, ese futuro está a nuestro alcance. Sé que lo lograremos juntos. Quédense seguros, quédense en buena salud y quédense en casa. Fuerza y amor. Thanks, everybody. Have a good night.